Chimeric antigen receptor T lymphocyte therapy, or CAR T cell therapy, has generated tremendous excitement, showing rapid and durable responses in patients with dismal prognosis and limited treatment options. In this OncLive peer exchange discussion, I'm joined by a panel of experts in CAR T cell therapy research. Together, we will look at the latest data, including data from the ASH 2019 annual meeting, to shed light on how the role of these therapies is evolving and how they will shape the treatment landscape over the next several years as our clinical experience grows. I'm Dr. David Maloney, member of the Clinical Research Division at the Fred Hutchinson Cancer Research Center and the Medical Director of the Cellular Immunotherapy Program at the Bezos Family Immunotherapy Clinic at Seattle Cancer Care Alliance in Seattle, Washington. Today, I'm joined by Dr. Karen Jacobson, Medical Director of the Immune Effector Cell Therapy Program at Dana-Farber Cancer Institute, and an Assistant Professor of Medicine at Harvard Medical School in Boston, Massachusetts. Dr. Fred Locke, Vice Chair and Associate Member at the Department of Blood and Marrow Transplant and Cellular Immunotherapy, and the co-leader of the Moffitt Immunotherapy Program in Tampa, Florida. Dr. Max Topp, Board-Certified Physician in Hematology and Oncology at the University Hospital of Würzburg, Germany, and Dr. Jason Weston, Associate Professor in the Department of Lymphoma Myeloma, Division of Cancer Medicine at the University of Texas, MD Anderson Cancer Center in Houston, Texas. Thank you for joining us, and let's begin. Today, we're going to look at the first approved CAR T cell commercial product, which is the treatment of pediatric and young adult ALL. So how has the availability of CAR T cell therapy changed the treatment landscape for patients with pediatric and young adult ALL? And Fred.
So full disclosure, I am not a pediatrician and I treat adults. I'm a medical oncologist. I do have 5 children, so I don't know if that makes me an expert in CAR T cell therapy for children, but patients who have failed, pediatric patients who have progressed despite first line, second line, or third line chemotherapy, or who have relapsed after an allogeneic transplant have historically done very poorly. These are patients who have a very low chance of prolonged disease-free survival. And the approval of CAR T cell therapy, CD19-directed CAR T cell therapy for these patients is really transformational, and it's really affording opportunities for long-term durable responses in about half of these patients who really were without other treatment options.
So I think our results are from the ELIANA study with tisagen and laclusil, which led to these really paradigm-shifting opportunities for patients with ALL. But now we're beginning to see real-world data. What do people think about the real-world data that we've seen so far?
Well, it was just a nice abstract being reported at our conference in 159 patients, and in which the results were confirmed of the ELIANA trial, that the majority of patients had a great response, 80% objective response rate, and a very high rate of MRD positive negativity after treatment.
Yeah, I think Dr. Grupp presented the data from the CIBMTR, and that really, I think, confirmed pretty much the results from the ELIANA trial. Around 85 to 90% of patients had MRD negative, or majority of them were MRD negative remissions. Obviously, the follow-up is still quite short, but I think it confirms that you can take this from a clinical trial setting into the real-world setting and do it safely. I mean, there clearly are still the risks of cytokine release syndrome and neurologic toxicity, which appeared, I think, similar, maybe even a little better than the clinical trial data, because I think people are getting more used to dealing with these treatment options.
I want to just interject one thing, which is that the number of patients that are eligible for the pediatric and young adult indication that are actually getting treated match. And I think we'll talk later about how there's a discrepancy between eligible patients for lymphoma. But I think the fact that these patients are being referred and are being treated speaks to the fact that people are seeing efficacy and that this is really paradigm shifting.
Yeah, we're all pretty much adult oncologists here. And so at least at our center, we're only treating the 18 to 25-year-old range here, so there's relatively limited experience. But in our experience, we've been able to give this product actually in the outpatient setting, I think in part because of the 4-1B construct, but there is clearly real-world experience that's being developed. There was some additional data presented from another CAR called the CARPIL or CARPAL study. Max, do you want to say anything about that?
Well, I think it's just another approach of actually using this very exciting technology. There's some tweaks that have been made to the construct, but overall, with the limited data set of approximately 20 patients, we just can comment on saying that is very similar efficacy rate, similar toxicity rate. And so we just have to see if other designs in the second generation CAR T-cell products will make a difference on the long term if we have a greater data set. But I think there are many ways of really applying this technology to this patient population.